topics and opinions expressed in the following show are solely those of the hosts and their guests and not those of W4CY Radio, its employees, or affiliates. We make no recommendations or endorsements for radio show programs, services, or products mentioned on air or on our web. No liability, explicit or implied, shall be extended to W4CY Radio or its employees or affiliates. Any questions or comments should be directed to those show hosts. Thank you for choosing W4CY Radio.
Welcome to the Ask the Expert show on W4CY Radio and Talk4 TV, where we bring you educational information from top local experts in the fields of legal, health, financial, and home improvement. Now sit back and listen to experts in family law, association law, hearing loss, business brokers, home care, along with many other topics. Now here are your hosts, Steve-O and Sophia.
Hey, good afternoon, New Jersey. Welcome to another Ask the Expert show, where for the last 16 years we have bringing you the top experts in the field of legal, health, financial, and home improvement. I am so lucky because we start getting inundated by calls from our New Jersey listeners asking us to do a show on Medicare. And we basically have been sold out for about the last 3 years. And this year we made an opening, and I was so lucky. I found one of the top agents in New Jersey. It's called Joseph Insurance Broker. And let me introduce you to Peter Joseph. Good afternoon, Peter.
Good afternoon. How are you, Steve?
Hey, we did it. I got to tell you, we started working on this, and I was getting a lot of calls from New York agents who wanted New Jersey too. And New Jersey's an important market for us, and I wanted somebody in New Jersey. Joseph, Peter, I got to ask you, first of all, how long have you been doing this for?
So coming up on 10 years, Steve, been doing this, and
Wow.
It's been fun.
Tell us about your agency.
So we are a brokerage out here in Southern California, but we are licensed in 34 states. We've got quite a few clients actually in New Jersey, and we've got a brokerage of 22 agents and one virtual assistant and then one office administrator. So we've grown like gangbusters probably this last 2 years.
You know what? I want to apologize. We signed two companies up at the same time. It was Peter and it was another company, and one's in California and one's in New Jersey. And I am so sorry. I am going to actually give you a free show this month because I screwed up so bad. You're in California.
That's okay. Hey, we operate in New Jersey too, so that not a problem. But I appreciate that, Steve.
Well, California is without a doubt our most important market. And I got to tell you that I'm so glad to have you because so many people, including myself, Peter, that didn't understand Medicare. And I got to tell you, it cost me dearly. And I know you know what that means.
Yeah, unfortunately, if you miss the boat and you guys apply late, you do incur a penalty, and that penalty never goes away. So unfortunately,
Mm.
um, so there's a couple of penalties that happen if you don't sign up for Medicare Part B in time when you're eligible. There's a 10% penalty each year that continues for the rest of your life. Now, the Part D penalty, which is for your prescription drugs, there's so many letters out there. That's why it gets confusing for everyone. But your prescription drug plan, if you don't sign up when you're eligible, that's a little bit less. It's about 32 cents a month, a penalty. It is a penalty for life, but it's a lot less than the Medicare Part B.
And I missed the enrollment. I had to wait a year, Peter,
Oh,
till I
man.
could come back. But I got to tell you, I hear some people say they're not happy with Medicare. I'm going to tell you, I love Medicare. It has been incredible for me. I went with the HMO, and people said, "Oh, you're going to have to work with the doctors in the network." I got to tell you, every specialist I have been so happy with, and if you're going into Medicare for the first time, I'm telling you, you're going to love it.
You are, and it takes a little bit of getting used to, but obviously, the costs go down substantially from when you're under 65 to when you're over 65. That's the nice thing. It is black. It's like night and day. Very
Yes,
black and white. Yeah, it's crazy. So, you need to go with an expert like myself or any other trusted broker to kind of navigate the networks out there. There's certain carriers that are easier to navigate than others. But if you're with the right one, Steve, like you said, it is a breath of fresh air, and it really is not that complicated. Authorizations don't take as long as people think, and yeah, it's the cost that definitely go down dramatically.
I am going to tell everybody this. The agent is so important. My first agent, I just called him an order taker. I mean, he missed my second year and said, "Well, I just put you down with the same company." And there were so many changes. It is so important, Peter, that people get a good agent. And even those ones you see on TV, the prices and what's offered are different by county, aren't they?
They are, yeah, and even the drug prices are different with different carriers, different formulary structures. So, we abide by, and we're our reputation is great in terms of we check in with our clients more than just once a year. We actually check in 3 times a year, and we want to make sure that
I
they're
love it.
happy. Yeah, you want to make sure they're happy with the plan, that it's covering everything you had promised them that it was going to cover. And there are frustrations along the way sometimes, and that's where agents come in and become the advocate for the client. So you're right on that, Steve. It's really important to have someone by their side, navigating that journey with them.
So I'm going to tell you, we started promoting your show 2 days ago.
Okay.
You would not believe what the biggest question is. Number one question that people had was, what is the difference between Medicare and Medicaid? I'm sure you probably already knew that.
Yep, that we get that all the time, and when we're helping clients, they don't know which is which, and so Medicare is our federal state, or actually our federal insurance. So Medicaid is the state insurance. So that's the biggest difference. One is federal and one is state. Now, everyone pays into Medicare if you work in this country. It gets taken out of your paychecks. And so that goes to Social Security and Medicare. We all pay into that system. Medicaid is a state program for lower income individuals. So usually an individual who's making about $19,000 a year or less, they get situated with Medicaid. They have to apply for it through their county, and that takes care of all their health needs, and that coordinates also with Medicare. So that's the biggest difference.
I got to tell you, the most confusing thing when I first started were the different parts A, B, C, and D. And that's probably the second most asked question is, have your expert explain A, B, C, and D.
Well, and what's funny is that they're even thinking of implementing more letters. Can you believe that? I'm like, no,
No,
please. I think we got enough letters to confuse our
right,
seniors,
right,
right?
right.
Oh my goodness. Okay, so just briefly, A is everyone is entitled to that for free. If you work 10 years in this country full time, you're also a citizen for 5 years. A covers your hospitalization. It also covers skilled nursing, and it covers hospice. And all that is free to everyone. if you work 10 years in the country. B, as in boy, actually covers your doctor visits, your preventative care, your labs, x-rays, all of that nitty-gritty stuff. And so B is something that we actually all have to pay. Most individuals will pay, this last year was $185 a month. That does tend to go up and down every year. So, but that is part B, and that's the one that everyone needs to sign up for when they turn 65 or come off an employer plan. Now, C, this is where it gets kind of confusing for a lot of folks. C includes A, B, and D as in dog. All right. So C is what you're called your Medicare Advantage plan. Those are your network plans like an HMO or PPO. And so if you're with a C, it coordinates with Medicare and it takes care of your A, B, and D as in dog. And then the last letter is D as in dog. That is your prescription drug plan. It just covers prescriptions. So when you turn 65, most folks will do a couple pathways. They'll do Medicare and a Part D plan, or they'll do a Part C plan, Medicare Advantage, which will take care of everything. The third option, which gets confusing, is a Medicare supplement or Medigap plan with a Part D plan. So Medicare supplement is actually a pricier alternative. And what I mean by that is you pay an extra premium for that plan. It covers the 20% Medicare doesn't cover. So Medicare would cover 80%, your supplement covers 20%. So that's with folks that have a larger budget. They want to see whatever doctor they want. They don't want to get authorizations or wait for prior authorizations. They can just go into a specialist office without that authorization. So I hope that makes sense. I know it's confusing, but that's as simple as I can make it at this point.
I got a funny story for you. So
All right.
I am with Advantage.
Okay.
And so they were telling me this year they're going to put, I think it's 190 this year into my Social Security. I don't get it, but it basically pays for my supplement. Then I heard that so I'm getting more money this year, but I also heard it's going to cost more this year. That those rates are going up. I was like, wow, I'm going to have a little extra money there. Doesn't work that way. They went
Yeah.
up because it went up this year, from what I understand. Someone just wrote just now. They want to know: do you care? Do you work with many different insurance companies?
Yeah, we actually, so we do more than Medicare, but Medicare is our specialty, and we actually are a broker. So let me just kind of explain how that works. We don't get paid any more from one carrier to the next. We get paid the same exact amount. So that way we don't have a bias towards one carrier or the other. We get paid the same amount. And so we actually broker out with quite a few carriers. I would say on the Medicare side, we probably have about 60 carriers that we work with.
So it's you're an independent then.
That is correct. Independent. We're not a captive agency.
Okay, so I hope that answers your question. Now, tell people they need to call you now. This is the open enrollment period. They need to call you now. And what happens is you have to help them to, I guess, maneuver through all the different companies and what's best for them. That's now, right?
Yeah, that is now. So open enrollment for Medicare is October 15th through December 7th. That hasn't changed in the last 15 years. So that is the time to have someone review your plan, make sure your costs aren't going up for next year. Because like Steve mentioned earlier, changes happen every year with Medicare, unfortunately. And so you got to stay on top of it. You don't want to just stay with the same plan sometimes every year because those costs might go up for you. And so calling me, we would look up all your prescription costs for next year. We'd look over your doctor medical networks and make sure all that aligns with the plans that we're looking at. So that is really important. Yes, if you don't have a broker or an agent, please give us a call.
I'm going to tell you another reason why you should have a good agent like Peter. I don't know if it's like this in California, Peter, but here in Florida, um, I I had to have a certain orthopedic surgeon in the group. I wanted them part of the group if I ever needed a specialist. But it turned out that my provider doesn't work with that. They have their own group. Do you have it? Have you ever heard of that in California?
Yeah, that happens in quite a few states. It's not just out there in Florida, and so there are workarounds. Again, we play the advocate. We can actually call the carrier and see if we can make an exception to that rule. Sometimes
Oh,
doctors play nice, and sometimes they don't. So, but there are ways around it. If you really want that particular specialist, then we work with the doctor's office and see if we can make it happen.
now what about if you're still working? Do you still sign up for Medicare?
So that's a great question, Steve. There's a couple scenarios. So if you work for an employer that has 20 employees or less, then you are required to get onto Medicare. If it's more than 20 full-time employees, then you have a choice to stay with your employer health insurance or go onto Medicare. And so again, that's where an agent comes in and compares the plan you're currently on with your employer to see if it makes sense to stay on that plan or to go onto Medicare where it might cut your costs, but it doesn't always. And so, we definitely have to review that and see what's best for the client.
We just got this is from San Diego.
Okay.
Great show. I'm so glad someone's doing a show on Medicare, and it sounds like your expert really knows what he's talking about. Tony, this must be a cousin of yours. It's got to. No, I'm kidding. Yeah.
Oh, yeah.
But they want to know are basically for Medicare. You said there's no cost to Medicare. It's when you get into the other B, C, the supplement plans, are those all priced out the same? That's a
They
good
are
question.
not. So that is a great question. So again, we all pay for Medicare Part B as in boy. So that's a little different. But then in terms of the Medicare Advantage, um, most of them out there are actually a $0 premium. But there are some where there will be a premium of like $40 to $50 per month. Usually those are the PPO networks versus the HMO. And so they're not all priced the same in a nutshell. That's the answer.
I think mine runs me about 180 a month, but it is so worth it. It is so amazing. Yeah, especially if you got like going to a hospital or you've got a lot of drugs that you take, you
Yeah.
really appreciate it. It is so. What other areas you, you do other health areas, Tony?
Yeah, we do so we do health insurance for under 65. That's kind of a
Good.
mess right now, Steve, unfortunately, because of the government shutdown. We don't
Yes,
know where those prices are going to be for next year, depending
exactly.
on what Congress does. But and then we also do small business group benefits. So if
Oh,
you're a
good.
small employer with employees and you're trying to keep them in the fold, offering them health insurance is the best way to keep them from leaving your company. So we do set those up for them.
Now, what about we haven't really talked about dental and vision and hearing.
So we do have standalone plans that we offer our clients for dental, vision, and hearing. Um, and it really depends on what plan the client's on. Some of these Medicare Advantage plans do include those, and some you have to pay an extra fee to get some extra benefits on that side. So that's the nice thing about Advantage plans. Everything's all in one instead of the a la carte, thing with the supplements. So but yeah, we could take a look and we definitely offer both.
But I want to tell everybody something, and this is not your doing. So 3 years ago on my plan, I went in for glasses. There's no charge for the eye exam. I mean, I didn't have to pay anything for the glasses. I went in this year and I had to pay $140.
Wow.
So you've really got to look at the rates. And, a lot of people, when we get over 60, 65, wear glasses. And that for sure is an area you want to be sure of. But mine covers it, but not near what they used to.
Yeah, and usually what I tell my clients too, sometimes vision insurance is not the best option. It might be cheaper for individuals to go through like a wholesale, like Costco or Sam's Club, and get
Hmm.
their eye exam and frames that way. Because you end up paying about $30 a month on these vision plans, and you're still paying out expenses just like you did. And so it's kind of money down the tubes. You might as well just not have a vision insurance and go directly through like a wholesale club.
That makes sense.
Yeah.
What about, Peter, what about deductibles and copays? Can you kind of explain that?
Yeah. So most Medicare Advantage plans will have, it's not per se a deductible. It's called max out of pocket expenses. So it's a little bit different than what people are used to with their health insurance under 65. And so what that means is any copays that you make towards the doctor's office or specialist, any lab fees that you have or x-rays, that all goes towards the out-of-pocket costs.
Mm.
And once you meet that max out-of-pocket, then everything's paid out 100%. So you won't have any more copays when you go to the office, no more payments when you get x-rays, and some of these, I know we're in New Jersey, but in California, it is crazy how competitive it is out here because some of these plans, the max out of pocket is maybe $100, believe it or not.
Wow.
So it is crazy. And in comparison, out in New Jersey, it might be $4,000 to $5,000. So you could see there's a big difference there.
Here's Carol in Malibu. Love your show. I hope you'll be doing another one. We are. Peter's going to be back again with us next month. Uh, my question is I'm just starting off with Medicare, and do I come to your office, or is it done by Zoom?
Oh, that's a great question. So
Yeah.
we do it all, and we actually, I didn't touch on this earlier, but we, had such a crazy time during the pandemic because everyone was, indoors and we had to
Yes.
adjust. And so that's when we started doing Zoom, and it worked out really well. So to answer her question, yes, we do Zoom. We also do over the phone, and we also do in person, either at our office or we could go to their home to conduct the appointment.
And Marvin, he said, I hope you get to ask your expert this question. Um, does he prefer HMO or PPO?
So, that has changed over the years. When I first did this, I would say PPO. Now, unfortunately, PPOs are exiting the market in the Medicare Advantage field.
Mm.
So people aren't having as many choices as they used to have. PPOs tend to be costlier than HMOs. And so, if you're with the right carrier and you're with the right medical network, I would say HMOs are the way to go.
Peter, I got to tell you, I am so glad that we have you. I can't believe we have to wait another, I guess, 2 or 3 weeks for your
Yeah.
show next month. But tell people how they can reach you.
Yeah, of course. So there's two specific ways. You can go to our website and make an appointment. That is josephinsurancebroker.com. Or you can call me direct, area code 909-217-2630. And I will actually pick up the phone. You won't hear an answering machine.
I got to also tell people when you see those ads on the 800 number, you know what? I'm telling you, that sometimes it's too good to be true. I found that out too. It is so much better to have an agent because he knows the counties that you're in and the different rates and what. and they'll do all the legwork. You don't have to do anything. And it's so important. That's why I'm so glad, Peter, that we have your company. And I guess we'll see you again next month. And I was surprised how many calls we got for the first show.
Hey, that's great. Thanks, Steve.
Yeah.
I appreciate
Okay,
it.
Peter. I'll be sending you the show in the next couple days.
All right. Sounds great. Thank you so much.
That's Peter Johnson. Thanks, Peter. That's Peter Joseph, the Joseph Insurance Broker. Again, 909-217-2630. Hey, that's going to do it for us today. Now I'm in the right state finally. We'll see you next week with more Ask the Experts.
Thanks for tuning in today to the Ask the Expert show on W4CY Radio and Talk4 TV. Tune in next week and every week to hear more from our experts on personal injury, insurance, air condition repairs, estate planning, Medicare, and many other topics in the areas of legal, health, financial, and home improvement. See you next week.